Wake up, Glenn, Angel, and the Flying Dutchman.
Wake up in the morning feeling like
Kiss 92's Big Show.
Good morning and welcome to another edition of The Big Show's Good Morning Doctor. And this morning we have Dr. Lincoln Tan, Urology and Robotic Surgeon from Gleneagles Hospital. We'll be talking about kidney stones today. Good morning, Dr. Tan.
Good morning, everyone. Thank you for having me.
Good morning. Thanks so much for waking up early and joining us here today. So let's just jump straight into the topic of kidney stones. Thank goodness none of us here in the studio have experienced kidney stones, and I don't think we ever want to in our lifetime. What exactly are kidney stones and how are they formed?
So, when our kidneys process the waste of our body, they excrete minerals, naturally occurring minerals in the urine. And when the concentration of these minerals in the urine becomes too high, they actually crystallize. And when these crystals clump together, they form little pebbles or stones.
Is that kind of like when you boil water in your kettle and all that calcium deposit, gets created and doesn't get cleaned out?
Well, it's basically more about concentration. If you remember your chemistry in school, right? It's about saturation. So when the water is too saturated with these minerals, they crystallize.
Oh, wow.
So what my mom used to tell me when I was growing up, right? Maybe she was trying to stop me from drinking, too much, soft drinks and wanted me to drink more water. So she always told me, drink more water, don't drink all these carbonated drinks because it causes gallstones. Gallstones, kidney stones, are they the same?
Oh, no. So gallstones are in your gallbladder.
Okay.
Kidney stones are in your urinary system. So two different systems.
Okay.
But are they formed the same way?
No, differently.
No, differently as well. Okay.
So, but there is some truth to what your mom said. So cola drinks generally do have a higher risk of forming stones. So we generally say drink enough fluids. Most of it should be water because you can't be drinking 1 liter of coffee or tea and all that. But generally the ones that we discourage would be like your cola drinks.
Okay, sugary drinks basically.
Sugary drinks, correct.
Okay.
Is anyone more predisposed to getting kidney stones?
Well, actually, 1 in 10 of us actually will have a chance of getting a stone in our lifetime. And men are 2 times more likely to have stones than women, but that gender gap is actually narrowing. All right.
why?
I think, we don't really know why. For say, I said some postulations that more women are getting into the workforce. Maybe the diets are becoming more like men. We don't know. Okay, but a lot of it is lifestyle risk factors. All right. So people who maybe have a bit of excessive weight, people don't drink enough water, too much salt, too much protein in your diet. So maybe a lot of people maybe going back to the gym, drinking, maybe taking excessive protein. So these are all the certain risk factors that you are predisposed to stones.
Oh, excessive protein.
Excessive, too much.
I've been
much
taking
of it.
quite a bit of protein now that I've started training again.
Doctors.
So I think
here.
I better not.
No, I think I always tell my patients, if you're using it, that's fine, right? But so don't take the protein and then don't go to the
Don't
gym.
work out.
Oh, yeah.
Right.
So and then of course you got to know your macros. You got to know that you're taking enough. I think you should have enough protein. I definitely encourage people to go to the gym, build their muscle. But some people are taking like 3-4 protein shakes, but that the workout doesn't really justify that much protein.
Got it. Okay. As long as you're burning it off.
Right.
Okay. Let's go on the Big Show TV and continue to talk to Dr. Lincoln Tan, Urology and Robotic Surgeon at Gleneagles Hospital, about kidney stones.
All right, here's Niall Horan, Heaven on Kiss 92. Okay.
So signs and symptoms that you may have kidney stones, other than extreme pain when you pee.
Oh.
Is that
Is
one of them?
that one sign?
So yes, the main symptom of stones is pain. So it depends on where the stone is and how how big it is. So if it's in the kidney itself, generally you may feel like a dull ache in the left or right side of your back. And actually the real pain comes when the stones drop into your ureter. So the ureter is the tube between our kidney and our bladder. So as the stone travels downwards, it can cause this very severe contraction that comes and goes. The patient doesn't have any place that's comfortable and they feel nauseous, they vomit. And as the pain goes downwards, you can actually feel the pain go down towards your testicles.
Oh my gosh, I can actually feel
And
it.
then you may feel like you have difficulty passing urine. You may see blood in the urine. And then if there are complications like infections, that's when you get fever. And then the burning when you pass urine, that's usually a sign of more of an infection rather than a stone, the burning pain.
So that's already a late stage. I mean, it starts, you said, with the ache in your lower back.
So it depends on the position. So,
Okay.
So many stones actually don't give any symptoms. But when they start moving or they start growing, then you may start to feel this aching, and then suddenly when it drops, that's when it really causes the severe pain.
Right. So when we say stones, right? Because I mean, now we're talking about kidney stones, and earlier on I was talking about
Gallbladder stones.
stones in the bladder,
Gallbladder.
gallbladder in the bladder. What are these stones actually?
So like I said, they're crystallization of minerals. Okay. Often, most commonly we'll say calcium with another mineral, oxalate or phosphate. And rarely, less commonly we have uric acid stones. So people with gout, they can form uric acid stones. So there are many different constituents of stones.
Right. So before you guys could blast the stones, right? What was the old-fashioned way of removing stones in the bladder or in the kidney? Because I remember like years ago, all of a sudden it seemed like it was a new way of disintegrating the stones, and then you kind of like pass it out by sitting in something with like sound waves and you know what I mean?
Sounds like
that's
like
a
a camp.
blast from the past. Thanks, Glenn.
Right.
So I think what you're describing, the shockwave therapy, basically we call it ESWL, extracorporeal shockwave lithotripsy, essentially is using sound wave energy. So it's a non-invasive procedure, and we use the sound waves to blast the stones to tiny fragments such that they can pass it out. But this technology has been around for maybe about 30 years already.
Still being used?
Yes, still being used.
Okay.
Because it's still very popular, because it's non-invasive.
Yeah.
I think prior to that, we would actually cut open the kidney and take out the stones. So that was way back then. We haven't done that. I mean, it's very rare to do that
You
type of
don't need
surgery
to,
anymore.
right?
Yeah.
And those stones that may not be suitable for shockwave therapy, we do have what we call uteroscopy or endoscopes, basically little cameras that go through the urine passage, and we go directly up to the stone, and we have various tools, lasers,
to break it down.
to break the stone to little pieces. We have baskets that we can grab them
Oh
and
my
pull them
gosh.
out.
Right.
Wow.
Yeah.
So it's a lot safer these days than when you guys had to cut.
It's a lot
open.
less invasive now.
Oh, wow.
Are there any other treatments if someone doesn't want to opt for the surgery?
Okay, so again, depends on the stone. If it's very small, not causing much blockage, not causing much symptoms, we can allow the stone to pass out by itself. All right, sometimes there's a little bit of medication we can to help it along, but these are only for selected stones. And then in those guys who have the rare uric acid stones, there's about 10% of stones, we can actually try to dissolve the stones with medication. But most people, like 90% of patients, have calcium stones, and these will not be able to be dissolved.
Oh, calcium stones cannot be
Cannot
dissolved.
be dissolved.
Oh, but can they be broken down?
Broken down.
It's the same thing. Dissolve and broken down is the same.
When I say dissolve, means by taking something that you eat or drink.
Right. Okay.
Yeah.
Okay.
Broken down is when we
when you
break
get
it.
involved, right?
Yeah, when we get
Okay.
involved.
Okay. And like she was asking about treatments and all that. I can't remember my next question. FD, you go.
I'm
had
just I'm
something.
thinking about this. If I'm using sound waves to blast my kidneys, to smash these stones, are there side effects to these sound waves when it comes to your other organs?
Okay, so our kidneys are actually situated in our back, right? And just in front of that is the muscles. So the sound energy only goes through the muscles, the skin, the muscles, the fat, and then to the kidney. You're right, excessive energy can hurt the kidney. You can get bleeding. You can, if it's very severe, you can so-called fracture the kidney. But we know these energy levels. So we know that with a certain dose of energy that we can deliver to the kidney. So we only deliver up to that dose. Whether the stone breaks or not, we will stop. So we will always make sure that we keep the amount of energy we deliver to the kidney within a safe level.
Did you call it extracorporeal shockwave therapy?
Shockwave lithotripsy, yes.
Oh, that's what you did on your knee, and that's what I did
Oh,
on my
yeah.
back.
Yes, it's the same energy source.
At a physiotherapist.
But using a different dosing and different technique.
Right. Okay.
Oh
It's the
my
same
God.
technology.
I
That's what
was
it was.
screaming and shouting, man,
Well,
because my knee was really injured, and according to my therapist, she said the more injured your knee, the
more
more
painful.
pain you'll feel.
Is that the same?
And then
for-
after a few sessions, right, my knee improved, and she continued with the
Therapy.
it's
Shockwave.
sound wave or shockwave? It's
Shockwave.
it's called shockwave.
Shockwave.
But the energy is a sound wave energy.
And it was
But
less
it's called
painful.
shockwave.
It was less painful after
yeah.
that.
Also, it's different for us when we do the procedure. The patient's actually sedated. They actually have the best sleep of their life. Everybody wakes up wishing they could sleep some more.
Because it's too painful to.
It's like your kidney being gently punched about 3,000 times.
wow.
But when they're sedated, they don't feel anything. So most of them wake up with this beautiful smile and say, "Oh, doc, is it done?" And then
But
Do
when
they
you
feel
wake
like
up,
ache?
do you
Yeah.
feel anything?
you may feel a
after?
little bit of aching, not in a way, not the type of pain that you're describing. It's more of an aching kind of sensation, generally quite manageable. And then they may see some blood in the urine, which is why we always tell patients that's evidence of work done.
Okay, right,
Yeah,
okay.
yeah, so we did some work, and that's why you see a bit of blood.
Okay, so that's a good thing
Yes.
then. For someone who's had kidney stones, I'll ask this on air. For someone who's had kidney stones, is there a risk of it happening again?
Yes, unfortunately, the risk can be as high as 50% within the next 5 years.
Okay, let's talk about that again on
If you
on the
continue to
radio.
drink your colas.
And other things, I'm sure. We can ask about what
Okay.
type of foods would...
Stand by.
Everybody tend to arise on my nerve. Long time you look at you, but listen my word. Just baby girl, stay with me, girl. Just play with me, girl. Just baby girl.
Kiss 92 traffic.
Traffic CEO.
Queensway towards the AYE, a vehicle broken down at the Farah underpass. Avoid the left lane there. SLE towards the CTE, a vehicle broken down before Mundai Avenue exit. Please stay within the speed limit. Have everyone buckled up. Be safe as you drive today.
Good morning, Singapore. Welcome back to The Big Show and The Big Show TV. We are honored indeed to have Dr. Lincoln Tan, Urology and Robotic Surgeon from Gleneagles Hospital with us this morning. Good morning, Doctor.
Good morning.
Good morning. So, just to continue our conversation from the Big Show TV, for someone who's had their kidney stones removed, is there a risk of them getting kidney stones again?
Yes, so you have up to 50% chance of the stones coming back again within the next 5 years unless you change your lifestyle.
Oh, so this is assuming everything is
You don't change
you don't
anything.
change anything. And when you
Yes.
speak about lifestyle, what should people not be eating to sort of exacerbate that situation?
Actually, number one is actually to drink enough water.
Okay.
All right, so because this stones from a concentrated urine, so you want to make the urine dilute. So I encourage patients to drink between 2 to 2.5 liters of water a day, so maybe about 8 to 10 glasses. And I often ask them to observe the color of their urine. So if the urine is very light yellow or clear, then you know you're drinking enough, right? Because some people, soldiers, athletes, whatever, they may need 3-4 liters or
Yeah.
more because they really sweat a lot.
Yeah.
Right. So
okay.
number one is
Water.
dilution. Right. Drink enough water. Then in terms of diet, we'll advise have enough calcium in your diet. All right. So calcium, although these are calcium stones, calcium in your diet actually binds the other minerals that form stones. So
Right.
you want enough calcium in your diet. So I say no restriction on dairy or calcium in your diet. All right. And you want to have less salt. Okay, salt draws out the calcium into the urine, which is where we don't want it, and that forms stones. And then not to avoid excessive protein. You need enough protein, but avoid excessive protein in your diet.
Got it.
Okay, so I just want to talk about this because I've noticed this with myself. So I'm on heart medication, I take vitamins, I take whatever. And I find that my urine is not light colored or clear.
It's like oolong cha.
It's like tea?
It's like, no, it's not that dark.
It's like
but
chrysanthemum
but
tea.
it is yellow.
Yellow. Mm.
So in those cases, it may be a bit challenging because the medications themselves are coloring the urine. So you may not
okay.
be able to. So that's not from the concentration. It's because some medications actually color the urine. So for those patients, again, a little bit more difficult to judge. But if you drink enough, it will lighten up. It won't change it entirely to clear. You still have that color, but it will be lighter.
Okay, okay, because there's so many people who are on medications
Yeah.
and their urine is a different color.
Yeah, sometimes you take vitamins, you
And
know,
your-
and
it
your
changes
urine
the
is like
colour.
a funny yellow.
Yeah.
Neon yellow.
I don't know about the neon.
Yeah, excessive
when you
vitamin
take
C.
vitamins,
Yeah,
yeah.
excessive
Yeah, right.
vitamin C.
Vitamin C, right. So you're saying less salt. So that's also less processed foods.
Yes,
that
you're
we
right.
should be-
A lot of processed food is very high in salt. That's true.
What about exercise? Does that contribute to your risk being lowered for kidney stones?
Okay, so one of the risk factors for stones is people who have excessive weight or obese. So exercise certainly will help keep the weight down. But at the same time, if you have excessive exercise, that is in the sense that you don't drink enough water to compensate for that, then that will be a risk factor. So I would say exercise does help, but you make sure you're adequately hydrated.
Okay.
Oh my goodness.
Got
We
it.
need to treat our bodies like our cars, our vehicles. how
Yep.
we maintain our vehicles.
And our pets as well. We give our pets the best food and then we eat all the rubbish.
Which is true.
It
is
is
true,
true,
actually.
yeah.
Okay, let's continue to talk to Dr. Tan on The Big Show TV. It is 8:16.
Kiss 92 Time Check brought to you by Putian.
I have a question from Facebook.
Okay.
So Eddie has written in and he says, "Good morning, doctor. Apparently his mom had gallbladder stones removed." Oh, it's different, right?
Yeah,
It's different. But I don't know if you can answer this question. But
Give it a go.
He basically said her face was turning yellowish, so that was the indication that she had the gallbladder stone. She said, as long as the stones don't restrict your daily activities and mobility, you can actually ignore it. So is that the same for? Is it true
Kidney
for gallbladder?
stones.
Or is it
Okay,
is
so
also-
gallbladder stones are different.
Okay.
So the why his mom Eddie's mom turned yellow is because the gallbladder stone is actually connected to the liver.
To the liver. It's like jaundice, is it?
Yes, correct. It's jaundice. So when the stones drop into the duct that blocks the excretion of bile from your liver, then you can get jaundice.
Right,
Yeah.
okay.
So gallbladder stones, he's right in the sense that if they're not causing any symptoms, can often be observed. But if they cause symptoms, then often general surgeons, I don't do this surgery, but my colleagues would then consider cholecystectomy, or which is removal of the gallbladder and the stones.
Oh, wow. Removal of the gallbladder.
Yeah, it's not essential to have.
So we don't need it. Much like the appendix
yes.
and the
Correct.
tonsils, right?
Yes.
We don't need tonsils?
No, apparently not.
No.
Tonsils, appendix, and
Oh.
gallbladder.
As in, it's not essential. As in,
Not
you do have
essential.
some function, but you can
You
carry
can live
on
without
it. So when these organs become diseased, they become more of a burden than a help, right?
Got it.
Right.
But we don't remove them for no good reason.
Okay.
So if, let's say there were kidney stones, but they weren't giving someone any symptoms,
Can
you
you
think
leave
they'll
them?
just pass, or can they just exist without giving anyone pain?
So kidney stones, if they are small, they're not causing any pain, bleeding, or infection, can be safely observed. But if they show that they're growing, then we'll be concerned, because the bigger the stone, the higher the chance that if it drops, it blocks your kidney. Actually, we're more concerned that the kidney gets blocked. Because if the kidney gets blocked and it just goes untreated, you can actually lose that kidney.
Oh.
So it's the blockage that we worry about. Patients worry about pain, which
Yeah.
fair, but doctors worry about blockage.
Yeah.
Yeah, so we want to prevent that, we want to treat that so that you don't harm the kidney.
And how do you do a CT scan, or what's the way to see whether it's growing or not?
So there are various things we can do. We can use X-rays, ultrasounds, or CT scans. So depends on the situation. Your doctor will choose the best imaging for the stone.
Right.
So often we use CT scan at the first because that gives us the most information. But later on for follow-up, we may just use X-rays or ultrasound because you have less radiation for surveillance.
Okay.
Okay, the question I then have is, so we're looking at pain in the lower back, we're looking at the color of urine. Is there a way people can go to get regularly checked to see if they have kidney stones?
Yeah, you can get an ultrasound. So I think if you have no symptoms, ultrasound is a good first screening tool because you don't have any radiation. If you don't have any stones, you don't have to do it too often, maybe once a year.
But I don't think many people do that, right?
They don't, yeah,
unless,
yeah.
of course, you feel
Yes.
terrible discomfort.
Yeah.
There's no reason for you to
Correct.
Well, you
go look
do
for
get
it.
the people who are like, now I'm listening to this, I'm going to start to worry. So I just want to know if there's somewhere they can go to just get
But
checked.
yeah, it will show up in an X-ray.
X-rays may not be because the problem with kidney stones, if they're small or if they're what we call uric acid stones, they can't be seen on an X-ray.
Oh, right. Okay.
So even ultrasounds can sometimes miss small ones, but I think if those very, very small ones that you miss on ultrasound, maybe it's no big deal if you don't find them because they're not causing you any problem. So
Yeah.
we want to find those of a certain size that have the potential to cause problems.
Okay.
Okay. So tell us a little bit about robotic surgery because you are a robotic surgeon.
Yes. So when we say robotic surgery, basically it's using the Da Vinci robot. It's a tool to help us do surgery. And essentially we use it mainly, at least in my field, we use it for the removal of prostate for prostate cancer and for kidney cancer.
So how does it work? I mean, do you Do you manage a little joystick in the background or some keys for the robot to go in and do the surgery? How does that work?
It's like a video game.
Yeah.
In a way, sort of, it's a bit like a
Okay.
video game. So actually, we control it with 3 fingers here.
Okay.
And it controls the robotic arms.
Through a glove? Or
No, we actually
Okay.
have 3 rings on our fingers.
Right,
And we just
okay.
do something like that.
Okay.
And then we have pedals. All right.
Wow.
So with the pedals and these 3 rings on our fingers, we control remotely the robot hands. So the robotic hands are as flexible as our hands. So it's a much bigger improvement from laparoscopy, where it's a bit like operating with 2 chopsticks. This one's like really operating with
Your own
hands. In fact, you don't have only 2; you can have 4.
Oh, wow.
Under our control, and it's minimally invasive. So previously, when we used to remove the prostate, big surgeon, big hand. So when we used to use our hands, the cut was about this long.
Oh, and now?
Now we do it through less than a
Keyhole.
centimeter.
Oh my gosh!
Less
wow.
than a centimeter.
What?
And how much more accurate is it than a human hand?
So in terms of it's mainly the vision that you get a much better vision, a very stable platform for the hand. So we do much more finer surgery. Because previously we had to like crane our neck,
Right.
And we're seeing like from a long distance.
Now you
you're
can
like
really
up front,
zoom in.
Like you really zoom in up front.
Wow.
And so you're right. We do use much more precise surgery with the robot than we used to when we used to use open surgery.
My goodness.
I'm so fascinated
Yeah,
by surgeons.
same.
I mean, it's amazing. You're a robotic surgeon, but I'm sure you used to do
By your hand.
yeah.
I still do use laparoscopy, and I used to use hands. So we use different tools for different jobs.
Right.
Okay.
Have you watched the Japanese drama Dr. X?
Oh, I haven't heard about it.
Oh man, it's so
Yeah.
good. It's so inspiring.
To become a doctor or?
Yeah, I think as a surgeon, you'll enjoy the show.
Yeah, I've been.
Okay.
Someone has mentioned it to me. It's on my list.
Oh man,
Okay.
I've watched all the seasons.
How accurate are those shows? Like House and all that.
Oh well, okay. If you talk about, I used to watch Grey's Anatomy, House.
Oh,
So
rank
House,
them.
House is medically accurate. It's just that we don't get this type of weird and wonderful cases all the time or that often. But
Of
the
course.
medical
Jargon?
jargon, the medical, the technical information is actually accurate.
Okay.
It's very
Right.
accurate.
That's
What
good to
about
know.
Grey's Anatomy?
Grey's Anatomy, well, let's just say we don't get so much romance in the hospital.
Like ER?
There's no McDreamy in the hospital.
Well,
There's
unless I
no George
qualify.
Clooney.
I do want to ask though. A lot of us understand doctors who study medicine. They study surgery. We understand that concept. But this whole idea of the rings. How long does a doctor train
gonna
before he
ask
becomes
that.
The
proficient?
Lord of
in-
the Rings.
Well, I actually spent a year in Melbourne for a fellowship dedicated to learning about
Robotics.
this robotic surgery.
Okay.
So I think most of us either will get ourselves exposed and trained for at least about a year or so.
Okay.
Yeah.
On top of your.
I'm talking about, so we're really trained
Trained
surgeons. So this
surgeons, yeah.
addition to that. So it's sort of called a subspecialty interest.
Okay. Okay.
Back on air in a moment.
Kiss 92 traffic.
Alrighty, usual delays across the expressways this morning. There are a couple of areas to look out for. The SLE towards the CTE, a vehicle broken down before Mundai Avenue. The PIE towards Tuas, a vehicle broken down after Thompson Road. Queensway towards the AYE, a vehicle broken down at the Farrer underpass. Stay within the speed limit, please. Make sure you've got everyone buckled up. Be safe as you drive today.
Drink plenty of water and avoid drinking excessive cola drinks. We've got Dr. Lincoln Tan with us, urology and robotic surgeon from Gleneagles Hospital on Good Morning Doctor today.
We just had a really interesting conversation about robotics on the Big Show TV. And I just want to, I know it's not part of today's subject about kidney stones, but I just want to ask a little bit more about AI and robotics. Do you think that in future, your traditional studying of medicine that you've gone through, your 6 years and all that, will take a
6
back
years?
seat? Yeah,
Surely.
usually
More than
your
that.
medicine, depending, but you have your add-ons like your AI and all that. Do you think that will take more of a back seat to make way for AI and robotics for the future of medicine?
Wow. That's
You know,
that's
I
a big
mean-
Big question,
That's a
yeah.
big question. Okay, I think in terms of robotics, it's now already. We are
Okay.
using more and more robotics in surgery, and it's spreading from initially it was mainly in my field, urology, but now general surgeons, gynecologists, they're also using the robots. New robots are coming online, so robots are now.
Yeah,
Right?
yeah.
And they allow us surgeons to do more precise surgery through smaller incisions, do things that we previously couldn't do because of the application of this new technology. In terms of AI, guess AI, you talk about like Chat GPT and things
Well,
like that.
yeah, you know, for all applications.
I think in terms of you talk about in terms of the training of a doctor, yeah, I think perhaps it may help us learn certain things. But I think in terms of like the didactic knowledge, maybe you have it in your hands. Previously, we had to read a book, then now we can Google it, and now
Yeah.
we have AI.
Yeah.
It certainly at the moment now they're studying how it makes it easier for radiologists and pathologists to be faster, right? Because the AI will study all the images, they'll come up with some provisional diagnosis or something, and then the human specialist will have a look at it, you know, so they can do some of the grunt work earlier on.
It cuts the time. Okay,
Yeah,
okay.
so that's currently being studied for at least in radiology and pathology. It seems to be moving on. I think not so much in surgery yet, but I think it'll catch up.
Nice, nice.
Okay, doctor, before we let you go, since we were talking about kidney stones and all that, so before we let you go, how about letting everyone know once again what they need to do in order to reduce their risk of developing kidney stones?
Okay, so number one is to drink enough water. All right. I always recommend at least 2 to 2.5 liters of water. It's good if you can check your urine to see that you're well hydrated. Less salt in your diet. Make sure you have enough calcium in your diet, not too much protein, and there's certain called oxalates, so not too much chocolates and nuts.
Oh, really? I just had a little chocolate with nuts.
No,
You
I said not
never
too much.
accepted
Yeah, you can have. I've always tell patients, I never said you cannot take anything. I always just say don't take too much.
What about mineral water?
Mineral water, as opposed to
You're saying take water.
Yes.
So many of us are picking up
Yeah,
mineral
for me,
water.
I'm a San Pellegrino, sparkling water kind of guy.
I'm a filtered water
So I think no problem with that.
with all that.
Yeah,
Okay,
okay.
okay.
Yeah, I mean, you don't drink sparkling water all the time, right? And you don't drink mineral water all the time either.
Yeah.
But
I
now
think
there's
as long as you have enough
alkaline
fluids.
water.
Basically, there's
there's-
some fluids.
Fluids.
Yeah, okay.
Tap water is the best, actually.
Well, yes, tap water good, PUB good.
Thank you very much, Doctor, for joining us this morning.
Okay, thank you very much, guys.
We've been speaking to Dr. Lincoln Tan, Urology and Robotic Surgeon from Gleneagles Hospital.
Thank you for tuning in to the Big Show's Good.
Awesome. We're still live on Facebook, but we can take a picture.
Yes,
Oh, okay.
let's take a
we're
photo.
done with the interview.
Oh, cool.
Yeah, you did great.
Thank you.
Yeah.
Well, that went by really fast.
Yeah, it flies.
It
flies.
It flies.
Yeah.
Half an hour.
We'll ask you a couple questions. Done.
Yeah.
It didn't go by very quickly. It's like half an hour, man. Yeah.
I love the talk about the TV shows because I love like hospital TV shows.
Dr. X.
I have to watch it.
Very good.
Okay, 1, 2, 3. One more. 1, 2, 3. 1, 2, 3. 1, 2, 3. One more. 1, 2, 3.
You want to take a picture with Glenn
Well,
for
yeah,
your
I want to
friend?
take
For your friend.
We're still here. We're taking
We
photos.
haven't left you yet.
Not
have
yet.
another guest.
Another half an hour before we leave you.
We're photographicaling.
Thank you.
Photographing.
Just
Good morning, everyone.
Please say hi to them. Thank you so much, Doctor.
thank you.
Thanks so much for coming in. Thank you.
Nice to meet you. Nice to meet you.
Thank you, Doctor. Thanks. Thank you.
Have a nice day.
See you.
Bye-bye.
Oh wait, I wanted to ask. Do you get nervous? Do you still get nervous before surgery?
I'm more nervous for this. No problem.
Oh,
Let it
okay.
go, no problem.
See you.
Bye, Doctor. Bye-bye.
Do you think it's like? Oh.
And next we have Sean. Oh,
Hey!
that's somebody already said you have no tattoos.
Hello, Daphne. Nice to meet you.
Hey, Sean.
Okay,
I
that's
said
your
I would be
seat.
so surprised if he had no
Yeah,
tattoos.
That's your seat over there. Go ahead. Did you bring in your tattoo kit? Because Daphne wants a tattoo this
I would
morning.
totally get a tattoo
On the show. The seat doesn't go.
artist. You are.
It doesn't go down, unfortunately.
Yeah, unfortunately, it
It's
doesn't.
okay. Okay, so
Okay,
that's your camera,
yeah.
top right
Oh, that's
here.
perfect. Yeah.
And you're in
You
the
just
perfect
need to-
position.
Yeah.
Let me get my.
You can put your headphones. No need notes, you.
No,
we'll
like,
ask
it's
you
okay, it's okay,
We're
it's okay,
having
it's
a
okay.
conversation.
Yeah.
But
don't
never
worry.
mind, it's always
she
good
wants
to
his
have notes down
pointers,
there.
yeah.
Because we gotta ask him for some information.
Specific
Is this the
information.
earliest you've woken up in a while?
No. Usually I wake up very early.
Oh,
So
good.
that's very
Okay.
fresh. Looks like a
Good.
morning person, actually.
You can wear the headphones if you want. You don't have to. It's up to you. It helps.
Yeah.
Hello.
At least you know your
There you go.
levels.
We were just talking about kidney stones. We've got a comment on our Facebook page that goes, a traffic report should say you should keep your urinary tract free, as clear as the expressways.
Okay, coming on. Fall for You, secondhand serenade right here on Kiss 92. All the great songs in one place. You're tuned in to The Big Show and The Big Show TV right now. And our second guest for today is Sean O, director of the Singapore Ink Show 2023, happening at Suntec Singapore Convention Hall 403 on the 13th, 14th, and 15th of this month. It's coming.
Next weekend.
Yeah, next weekend.
Welcome, Sean.
Thank you, guys.
Good morning. If you want to
good
find out more information, it's sginkshow.com. Okay, I think, well, let's throw it out there. What do tattoos used to mean in the past, and what do they mean now? Because they have transitioned quite a bit, haven't they?
Yes. In the past, tattoo were often associated with the secret society.
Ah, yes.
that's
Yeah.
true.
Yeah, that's true.
However, as time progressed, tattoo are now seen as a form of art.
Yeah.
Yeah, tattoo can also symbolize a person's journey in life. Yeah, including like special events, people on remembrance of
Loved ones.
Yeah, loved one. Yeah.
Yeah, like Daphne, for example, has a few tattoos, and they're very
have meaning.
significant to you.
Yeah.
Every single
because-
tattoo I have means something
Yeah.
to me, and I think that's very more common now. But I definitely, I don't know about. I mean, you guys are all a little bit older, so I feel like you face more of that traditional mindset where tattoos were like
Gang related.
Yeah, exactly.
Yeah.
They had a negative connotation. When I first started getting tattoos, I go to Japan, cannot go onsen, I can't go into the hot springs and everything. But I feel like that's changing, right? So-
Yeah.
But not in Japan, though. You've
is
been to
still very
Japan, right,
strict,
Sean?
yes.
And every time I go to Japan, I stay at a hotel. I want to go take a dip, right, in the pool.
Oh,
they
won't
tell
let-
me to put a suit on. As in like a swimsuit.
No, really?
cover
Oh,
up.
Yes,
wow.
you gotta
Cover
cover up
up.
your tattoos.
Even for one tattoo?
because it's
Yes.
still related
Gang
to the
related.
Yakuza
Yakuza.
over there. And
Yeah.
of late, even Korea has banned
Yes.
tattoos and tattoo artists and all that.
No
So-
way.
Yeah,
Yeah.
that I heard actually. That I heard. But what about showing your tattoos in places like Japan and all that? So you can't walk around with a
So
short.
you can
You
walk
can.
around.
You can.
You just cannot go into the onsen or like some of the hot
pool.
springs.
Right,
Well, I
okay.
mean, because everyone is supposed to be naked, right? And I feel like that way, I don't know, maybe you stand out, you're different, people might stare at you more. I don't really know, but it's more of the Yakuza thing,
Yeah.
Yeah.
but it's still a thing.
But I guess in Singapore, Sean, in Singapore, I think it's much more accepted now.
Yes.
Right? I think it was hard to organize a Singapore Ink Show like maybe 15 years ago
Yes.
as it is now, because it's a big thing now. I mean, how big a crowd are you expecting for this forthcoming Singapore Ink Show?
3 days.
We expect to have 6,000.
Wow.
throughout the 3 days.
Okay, so tell us a little bit more about how it started, the Singapore Ink Show.
We started since 2017.
Okay.
Yeah, for my main business is a tattoo supply.
Tattoo supply.
Tattoo supply company.
Okay.
As in you
So-
supply the ink and all
Supply
that.
all the,
The needles.
Yeah, all the equipments.
So
for
so
tattoos.
how has that changed? I mean, has the ink become better quality? Have the needles become better quality? You know, I mean,
Yes.
as the years have gone on.
It's gone off. Usually in the oldest time, when you go to a tattoo shop, you always hear the machine sounds,
Yeah.
the beat. But now no.
Oh, really? It's very quiet.
Now they use rotary.
And they have
machines.
wireless ones also
A
now,
wireless
right?
pen, yeah.
Wireless
Yeah.
machines.
It's been a
I
while.
know,
since-
Sean, a lot of people are doing their own tattoos now.
I wanted to buy my own kit on like Shopee or something, but I didn't.
Let's talk about how safe that is or isn't.
Okay, let's continue to talk to the director of the Singapore Ink Show, Sean O, on The Big Show TV. Meantime, here's Twice Set Me Free on Kiss 92.
I want to ask if like everyone that goes to the ink show, do you think that all of them get tattoos, or do some people just like go just to check it out?
Just to check it out, some, I believe.
And some people don't even have tattoos. They just go for the interest of it, right? I mean, just to see.
Yes, because you can't just walk into a tattoo studio to look how it goes, how the tattoo be done.
That's true. That's true. What can we look forward to at the ink show? I mean, who do you have coming down? I hear you have some quite fairly big names.
Some superstars
coming down.
Yes.
Superstar tattoo artists.
Yes, we have Nico Hurtado, who will be flying in from US. He's a celebrity.
Oh, there you go.
Oh, there, yes. This is the guy, right?
Yeah,
Okay.
Yeah, he's the guy who did my...
Oh, wow.
Okay.
Yeah.
Wow, what is that?
Yeah, this is my son.
Oh,
Wow, that's
it's
a really nice
adorable.
tattoo.
This one is
Beautiful
the
portrait.
Second son.
Wow, beautiful portrait.
It's so
So
well
realistic.
done.
So he did both. He did that
Did
whole
both,
thing.
yeah.
Hey, can I ask you something, Sean? Okay, because I mean, let's talk about pricing. So, let's say this guy, okay? Let's not talk about your tattoo, because I don't want to ask you how much you paid for it. But if someone wanted something like this for that guy, right, to do, how much would it cost, let's say, for a portrait like that?
About $5,000 US.
Okay. And how long did that take to get it done?
6 to 8 hours.
One sitting?
Yep. Yeah, just one portrait, one sitting.
One sitting.
For
Wow.
a single portrait, yeah.
Yeah, because a friend of mine who has a wife who just did a tattoo, right, a small one, by a Korean artist who was in Singapore.
Well known
I
as
think
well, right?
Supposed to be
Fine
well known.
line, fine
I
line
don't know.
tattoo.
I've not heard of that artist, and I can't remember the person's name as well. Charged her about $2,000 for it. So that's, I mean, that is
Sounds
that.
okay.
Did she get conned? I mean, it's just a small cross.
It is very individual. If you like the work, then I think it's worth it. Yeah.
Yeah.
You
Yeah,
can't
I think
really,
that's the-
you can't really
Can't
put
put
a
a price on
price
that,
on
yeah.
Yeah.
something that maybe she's only gonna have one tattoo for her whole life. Maybe I mean, unlikely. Once you get one, you
But
want
you're
more.
paying for the tattoo artist.
You're paying for the
Skill.
brand. You're
Just,
paying for the brand and the skill.
Yeah.
Right? Yeah.
So what else other than okay, we've got these celebrity tattoo artists coming in. What else will there be at the show?
So you can like watch people get tattoos.
What else can people do?
Yeah. Will there be people will be getting tattooed there as well? If they want to get their tattoo there, they can, right?
They can, yes.
Oh,
They
you
don't have
can
to
just
make a-
walk in and say, I want to get a tattoo?
Yes.
You
yes,
can, yeah?
You can,
Okay.
You can.
All right.
Oh, wow.
Amazing.
Okay.
Shalini, let's go. Let's go. Yeah, what else is happening at the show?
And we have some like live bands.
Okay.
You know,
Food?
and
Is there any food?
Yes, there's
there's food.
F&B.
Okay.
Oh, wow.
Okay, so
who are
it's a
some of
whole
the
thing.
live bands performing? Do you know?
Live band.
Yeah. Some of the bands that are performing there. Do you know who they are?
Let me see. I'm not too sure. It's Jeff. Is Jeff Ng or?
Oh,
Oh, okay. No, but you see, it's going to be great because you're going to be able to go to the show. You'll get to see people actually get tattoos.
Yep.
There'll be bands to listen to. There's food. So you get a complete experience.
yeah.
Is it a family show, Sean? I mean, would you
Yes.
take your kids there?
Sure.
Because I mean, there a lot of parents also will have this whole traditional mindset that if I take my children to a tattoo show, they're gonna grow up fully tattooed. You know what I mean? Why should parents take their kids if they want to?
I think it's good to guide your kids to show them the proper way of if you want to get a tattoo. Yeah, we since parents bring their children for to the tattoo shop to if they want to get a tattoo, they make sure that they get the right things, right,
right tools,
design,
right
or
design,
the
yeah.
right position.
Right,
Yeah,
okay,
this-
okay.
There's a lot.
So you
important.
can't fight it. You might as well go with
Yeah.
it and guide
Yeah.
them, right?
Guide them.
There will also be parents who will bring their kids down just to discourage them from getting
Yes,
tattoos.
that's true.
Well, like,
Yeah.
see, it's so painful next
That's
time.
true.
Don't get a tattoo, huh?
Okay. Apparently, Sean has brought something for us.
Oh.
You brought something for us. Why did you bring a gift?
What
for us?
is that?
No.
Oh my God! Isn't that the cutest? Did you draw that?
No, it's by
done-
One of the
by one of
artists?
the artists.
Done by one of the artists.
Oh,
That's so
wow.
cute. That is the cutest.
Which artist is
very
this?
cool.
Yeah, he's from Italy.
Oh, wow.
That is
Very nice.
amazing.
That's so cool.
That is
Thank
very,
you
very
so
cool.
much.
I can just see this tattoo on Shalini's back.
Wait, I'm on the
Can I see
website
that?
now.
Can I see?
And I can see that like there are so many artists, so many tattoo artists that are going to be at the Ink Show. And if you want to check out what their styles are like, you should definitely go to the website sginkshow.com, and then you can check out all the artists and what styles they have. You might need to book some of them in advance, right?
Yes.
But you can, like Sean says, you can walk in and try to you can make an appointment there, I guess, right?
Yes, that they do accept walk-in. Yeah.
Okay.
Oh,
Okay. There's
Okay.
so many guest artists that you have. So many.
Do you think that they charge a little bit more at something like this, like at a fest, or do you think it's like if you call them separately and then you go to see them later on? I'm just saying like if those 3 days that particular artist is sold out or booked out, do you think you can make an appointment for another day with them in their own studio?
If I think they usually just come for the event. They don't do stay long for guest spot or things like that.
Okay.
Ah, okay.
But there are local artists as well, right?
Local artists, you can do it there. The feeling is different when you do in a group, you see.
Okay.
Okay.
You start off
Yeah,
like
yeah.
encouraging each other.
And
Yeah,
there are
yeah,
also
yeah,
going to be
yeah.
competitions, Sean, that are
Yes.
going on, and very cool. Over all 3 days, they have best new artists for black and gray tattoos, best new artists for color, best in Western or traditional tattoos, abstract watercolor. So this will be a competition that will be like on stage. I mean,
Yes, on
so
stage.
the public can come in and they can see all the contestants and all that.
Yes.
Oh, that's going to be quite cool.
I think it's going to be a very,
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 very
cool
cool.
event.
Very cool.
Once again,
Okay.
it's happening next weekend, 13th, 14th, and 15th. Wait, 13th is a Friday, is it?
13, 14, 15.
13th,
Friday the
14th,
13th.
and 15th
Oh,
at
that's
Suntec Singapore Convention Hall 403. You can log on to sginkshow.com.
Yeah.
Can people purchase their tickets online?
Yes. So tickets start at $34. You just go to SG Ink Show and then it connects you to the Eventbrite page where you
Yeah.
can get your tickets.
I'm sure
Nice.
they can also buy their tickets at the door.
I don't know. Yeah.
At the door, yeah. There you go.
Yeah. So nice. I
yeah.
love the venue.
You're also
Singapore
on
Convention Hall.
Instagram, Singapore Ink
Suntec
Show.
City.
So go follow them on Instagram. 14.9 thousand followers. My goodness.
Thank you.
What's your next tattoo, Sean? Your next
Do you have
child.
any more space? I mean,
Yeah, my daughter.
Your daughter, so you are going to get another one. And is
Another
she
one.
going to be on the same arm?
Yes, probably inside.
Oh, wow.
Same tattoo artist.
Yes.
Wow.
That's a very expensive arm there.
Are you doing it at the Ink Show now?
No,
not
no,
for that.
not
Okay,
for that,
okay. All
Well,
right,
no,
cool.
it must take his time.
Take his time, right? Okay,
yeah,
coming
yeah.
up.
Yeah. Troy Sivan got me started right here on Kiss 92. All the great songs in one place. Let me see. Who got me started? The late Chris Ho got me
On
started
tattoos?
when it comes to tattoo.
Okay.
He brought me for my first tattoo, and now I have 14 tattoos.
Wow.
My first tattoo was at the age of 17 at a shop in Far East Plaza, and it was a rose. No significance of what it was. The rose was cool back then to get it done. So it was a rose on my hip. Yeah, that was
Is
my
it a red
first one.
rose?
It's quite faded right now. Yeah, but it was colored back in the day.
Yeah, maybe you should go down to the Singapore
And
Ink Show
recolor
and
it,
get
right?
them to touch it up.
Touch it up, yeah.
yeah.
My first tattoo was to celebrate 10 years with a radio station, and Glenn took me down.
So it was your name.
It was just my initials,
Initials.
just FD. that we did.
Okay. And Daphne, your first tattoo?
Wow, let's not talk about my first
Okay.
tattoo.
All right.
But do you still have your first tattoo?
Yes, it was because I have eczema. I used to have really bad eczema, so it's just a little star to test my skin.
Okay,
to see
so
whether
but that was your
That
first
was my
tattoo.
first tattoo.
Okay.
What
cool.
about you,
Your
Sean?
first.
What was your first tattoo?
Oh, it's also bad memories. I mean, it's good. It's not that bad. I mean, it's my journey of like getting know about tattoos.
Okay.
Yeah, it's not so nice.
You don't want to talk about that? Okay. How old were you though?
That time we were only 16.
16.
16 is the legal
Very young.
age,
Far
right?
East Plaza? No.
Mine was Far East Plaza.
Yeah, most people got it at Far East Plaza back
Yeah,
in the
my
day.
first one was at
Far
Far
East
East
Plaza.
Plaza.
Wow.
Yeah.
So all the kids that were either hanging at Cine or Far East, everyone was getting tattoos, is it?
Cine
Cine
Leisure.
Leisure, yeah.
No, back in our day, it was not Cine Leisure. It didn't even exist. I think it was. Far
Shout
East
out to my
Plaza.
tattoo artist Richard Tat.
Yeah.
Hey, Richard.
Anyway, Sean, I just want to ask you this, okay? Do you believe that people should not tattoo the names of their partners?
He's got his kids on his arm.
Now,
so-
kids is fine.
Kids-
like
kids-
girlfriend, wife,
Wives.
lah,
can
you know,
always
because,
cover up.
because they say, can cover up. But do you believe that it is jinx to actually have like
Sway. Is it
No,
sway?
no,
No.
I don't think so.
Really?
Yeah, I don't think so. Yeah.
Because I have asked some tattoo artists who actually discourage their customers from putting
Partners' names.
on because they've experienced it so many times.
Yeah.
You know?
What's the most unusual? You used to be a tattoo artist.
Yes.
Any unusual tattoos that you've had to do?
Some unusual. Usually is when they're youngs, they want to get tattoo like visible area. We will totally advise
Discourage.
them to discourage.
Oh, is
them,
it?
yeah.
Oh, okay.
It's not. I don't think they're ready. They are totally not ready.
Not
for
ready.
It.
So
Like
where?
16.
So where would you encourage? Where would you tell them to put it? Like somewhere
First-
that can't be seen.
The
yeah,
backside.
the shoulder,
Right,
the
okay.
shirt can be covered. Yeah.
Right,
Okay. Yeah.
That's why you see
good.
some of us, like for me, my rule is nothing below the elbow.
Yeah.
Because
Yeah.
of my work, sometimes I need to look like a bad boy. Sometimes I need to look like a good boy.
Is that your good boy face?
Yes,
You're
yes.
the bad boy. in the-
I just love that Glenn continues to refer to himself as boy.
This is true. Good observation.
Because when I say Batman, it
It's
sounds
been
a
a
bit
while.
serious. Batman.
Okay.
Okay, well, thank you very much, Sean, for joining us
you.
today, and we look forward to catching up with you at the Singapore Ink Show. We are all going to be there. We are all going to be there, right?
Yeah,
I'm definitely going to be there.
Okay.
Shalini!
I might be there like on all 3 days. I'm very, very, very excited about it.
Let's go!
Yeah.
13th, 14th, and 15th of October. Lots of things happening during the Singapore Ink Show that you can be part of and your family can be part of as well. Okay, it's happening at Suntec Singapore Convention Hall 403.
You can go to the website sginkshow.com to view all the information and to book your tickets.
Thank you very much, Sean.
Thank you, everyone.
Thank you.
Thank you.
Wake